All right, good evening, everyone. Thank you for joining us today. And now that it's finally warm, we're gonna start talking about and seeing a lot of these common summer injuries. So we'll talk about some of the most common things we see, ways to avoid them, and how we treat them. And please save some questions for us at the end. We'll be happy to discuss those. So bicycle injuries, one of the most common, of course. Wearing a helmet, very important, can reduce the chance of head injury by 85%. Uh, also, a lot of these collisions are not, just someone on their own, but, being hit by a car, and that, throws the biker off, and then you can't control kind of how you land, as opposed to, if you're dumping your own bike, you get a little more control of where you think you can land. Uh, and the whole body is obviously exposed in this case, and we want to protect the most important part. So one of the most common things we see from biking injuries, and this is either on the road or mountain bikers, especially a lot, we see dirt bikes, is the clavicle fracture. That's your collarbone. And, this is kind of the typical way that it breaks, as you see on the left side there, where the bones kind of split apart and they shorten. So what do we mean by that? I'll try to use this cursor. But this type of area here, should be there. And so that's the shortening. That's the important part, what determines if someone gets surgery. And if it's more than 2 centimeters or almost an inch shortened, it affects your shoulder function, your shoulder power. And so we're more likely to treat those surgically. And you can see there's a lot of strong, what we call deforming forces on this fracture. The pec tendon is pulling this part down, and the trapezius muscle, which is strong shoulder muscle, is pulling this part up. And so the farther apart those are, the less likely that you get healing. And so those are patients that we would take to surgery, put a plate and screws and restabilize and realign everything together. And the recovery from that's pretty quick. It's a couple of weeks in a sling and then getting the therapy going, and just giving the bone time to heal, which is 2 to 3 months, and then getting you back on that bike. Another common thing we see is what's called a distal radius fracture. So people are going to fall, the hands out, they're trying to protect themselves, and that's part of your wrist bone, the radius, which gets pushed backwards. And so we don't want to see that type of alignment where it's facing kind of backwards towards the non-palm side, but the back of the hand, because although it may heal like this in this crooked position, it will cause significant increased risk of arthritis, as well as loss of movement. And so again, what we do with this is we kind of realign this portion of the bone back on top, kind of putting the ice cream cone that fell off, the ice cream scoop kind of back on cone, and we hold that with a plate and screws. Again, all of these surgeries are outpatient, take probably an hour to do, and have fairly good outcomes. And then in kids, we're seeing this happen to this is actually my nephew's x-rays here that I was able to get. He fell off the bike, broke both of his own bones. Now he had to go and get this reset. And in kids, especially the younger they are, the better chance they have of healing. The bone can remodel itself. That's one of the things we love about orthopedics, is that bones can always find a way to heal. And the younger you are, the better chance they have to do that. So he was put in a cast for about 6 weeks and did well. Very rarely do we have to take the youngsters to surgery. Baseball and softball, of course, these is an outdoor sport, and not only these, but soccer is one of the more common activities now. Very important to make sure you're warming up and stretching properly, and that's a good 15 to 20 minutes. And I stress to the youngsters, or even the weekend warriors, take that time to do it, especially before you play. Get the muscle working at the level it wants to work. So, a muscle works by contracting kind of long and short. And so we want to get that length established so that you don't try to explode quickly and the muscle's not ready at that tension. And that's how you get, the hamstring pulls, uh, quad pulls, shoulder injuries because of improper warm-ups. Also, make sure you stay very hydrated, in between innings in baseball, when you're subbing in and out soccer, everybody knows the classic halftime mom's bringing in the juices and the oranges, but really, water is the best thing for that. And, keeping your electrolytes up, that's the best thing to stay hydrated and avoid heat exhaustion. Now, some symptoms of heat exhaustion, feeling dizzy, obviously someone collapsing, looking pale, mentally not able to answer and respond to the coaches. These are things we should definitely be looking out for in your own child or the kids that you're kind of coaching, to watch for heat exhaustion. And the key there is to, get hydrated, rest, and be monitored if needed. So some shoulder and elbow injuries. The most common things we see are rotator cuffs. This was a patient we fixed about 2 or 3 weeks ago. This is a pretty big tear. You can see the split of the rotator cuff muscles here. Those are the tendons that elevate the arm and lift up the arm. And the bone of the humerus, which is the arm bone, is down here. Okay? So the tear happens when that tendon lifts away from the bone, and that muscle is no longer functioning because it's not on the bone. It cannot create that pulling force to help lift. And so people come in and can't lift their arm, or if they do lift their arm, it's just very weak. And so what we do is we put some anchors down into the bone here, and through these sutures and our ability to tie these sutures down, we bring that tissue down to the bone. And then the body kind of does the rest and creates that connection once again. And that connection can take 4 to 6 months to really strengthen. And that's the hard part about rotator cuff surgery, is not so much the surgery itself, and we've gotten a lot better through minimally invasive and arthroscopic techniques, small incisions, but the recovery is long because the body needs that time to recover, to heal the tendon, and then work on strengthening it. But this is what it looks like, and it's one of the common injuries we have with overhead and throwing athletes, or even falls, again, from the bicycle. Tommy John surgery, it's definitely specific to baseball and javelin throwers as well, where the ligament that stabilizes the elbow on the inner side of the elbow gets torn. The reason that happens is because all of the power that generates from the legs goes up through the chest, the shoulder, ultimately gets translated to the elbow to create that torque and speed on the ball. And if you're not properly conditioned or trained to create the torque and the power from the legs, and you're trying to overpower it with your arm, it creates all these kind of small micro tears in that ligament. And over time, the ligament will not be able to withstand those forces and just pop. And then that's where people notice a loss of speed, loss of control in their elbow. And especially at a high school professional level, this requires a surgery which is successful but keeps you out of sport for about a year. Playground injuries. My wife talked me into building one of these in our house last year. COVID, couldn't take the kids out anywhere, and we ended up putting one of these up. And my kids are still young enough to be able to fit into those things, but obviously there's tons of ways you can get hurt here. We'll talk about some of those, but one important thing that's sometimes overlooked is the ground cover. You want to have a nice soft kind of rubber or soft kind of wood chips. Now they're even making like the synthetic turf. Look around, inspect some of the equipment, some of these older parts, make sure there's no rusty nails or, slides that are broken, which would increase risk of injury. This is actually my daughter's x-ray. You can see her name right there, Catherine Kesto. This is when she was 3. She was at school trying to climb a rock wall. Normally a pretty cautious girl, but ended up falling. And she had this fracture of her leg, which again, in young kids, don't need surgery, but we were able to put her in a cast for about 5 weeks and now she's back on and jumping on rock walls and trampolines, and with no fear. But certainly take the wrong step and you fall on this playground equipment, you can get this type of leg injury, or even like I showed earlier, the forearm fractures or the wrist fractures. The higher the speed, the bigger the injury, especially on ATVs, like I said before, dirt bikes, mini bikes. And this is a femur fracture. So the femur is the big bone in the thigh. This is one of the most common injuries we see from these high speed and high energy kind of ATV injuries. And this, ultimately has to have surgery. We'll put a big rod down the middle of the bone to help stabilize it. It goes in the canal. The advantage of having that surgery, at least in this bone, is, you can walk on it right away, but still takes it 3-4 months to heal up. Soccer, again, as I mentioned, one of the common sports that are, summertime and, sometimes indoor in the fall. But, one of the common injuries of soccer is an ACL tear. What is the ACL? ACL, as you see in this middle picture, is the main ligament in the front of the knee. The knee has 4 ligaments. The ACL, which is anterior cruciate ligament, is the front of the knee. The PCL, you can see here in the back, it's posterior cruciate ligament, helps stabilize the back side of the knee. You have the LCL, which is the lateral collateral ligament on the outside of the knee. And you have the MCL on the inside of the knee to help stabilize the side-to-side forces. And the ACL and PCL stabilize front to back. The difference with the ACL is it also controls rotation of the knee and pivoting and cutting. And so, an MCL or a PCL, oftentimes those don't need surgery. LCL, is 50-50 depending on the degree of injury. But an ACL does need surgery. And the reason is when you don't have that, you lose that rotational control. So every time you go to pivot or twist, your knee is going to buckle and give out on you, which will cause further damage inside the knee. And this can even happen as simple as, coming down the steps too quick or taking a wrong step off a curb. Your knee buckles and gives out, and that's the instability of the knee. And so the picture on the left is one we did a couple weeks ago. You can see that this is where the ligament was supposed to be, and this was an injury in a patient that, took them a year to finally decide to have surgery, but it was just not recommended. But, everybody has different reasons. So after surgery, you can see we put a new graft in there to replace that ACL on the right side there. And that can come either from your own hamstring tissue or your own patellar tendon. And sometimes we use cadaver tissue depending on the patient, but we like to use your own tissue if possible to give it the best chance to heal. The recovery from this is 6 to 9 months, lots of extensive therapy, strength training, and ultimately return to sports and activities that you love. Meniscus tear can also happen inside the knee. I'm going to go back one slide just to show you that, the anatomy on the diagram. But this cartilage here, that's the meniscus. You have one on the inside, which is medial, one on the outside, which is lateral. And that's the cushion between the two bones. Okay, the meniscus is important to preserve and for its function to prevent the development of arthritis. Once that meniscus is torn, you start to lose the cushion between the two bones, and those bones rubbing and hitting on each other wear down the cartilage of the knee, which you see here, this nice shiny white cartilage. So this is one of the complex tears that can happen. It's called the bucket handle tear. And the meniscus gets flipped into the middle of the knee, and the patient usually cannot straighten their leg out fully. Imagine this thing kind of going in and out and how painful that can be. It feels like you have a rock in your shoe type thing, but inside your knee, and it's just painful every time you try to straighten. And so again, as you see here in that same patient, we were able to kind of do this a couple weeks ago, and we were able to fix it. All these kind of blue lines you see here, those are the sutures, and now that's repaired. We put about 7 different sutures in there. That's stable. That's going to help preserve that joint, that side of the joint, with a nice functioning meniscus to absorb the pressure, acts as a shock absorber, a nice cushion in between the bones. Swimming, number one thing, never dive into shallow water. When you're jumping into lakes or rivers where you can't see the bottom, you go feet first. Be careful swimming in inclement weather, or such as this year, the wave pool, where they're creating large waves, and some of our inexperienced swimmers may not be able to handle that. Know where your exit points are, know where the safe points are. Avoid wearing headphones so you can hear any developing trouble. Trampolines, these parks, indoor parks, have been popping up over the last 5 or 6 years, getting a lot of popularity. I get nervous every time we take our kids there, that's for sure. But definitely, you want to minimize how many people are on the trampoline at the same time. Make sure it's set, if it's outdoors, on a soft surface, such as a lawn, and make sure it's secure. Again, looking for any areas that may have broken down if it was kept outside in the winter, or just from repetitive use. It's very important. And avoid doing somersaults and tumbling if you're not properly trained. This is one of the reasons why people get kind of severe injuries, is what's this rebound effect here, where the person thinks they're going to land on a soft area, but ends up being pressure going back up at the person, and that causes either a knee injury. I've seen 19-year-old dislocate his knee entirely and damage the nerves, cause a permanent injury to the nerve, as well as multiple ligament tears. One common fracture in the foot is this talus bone here. So you see the calcaneus, that's your heel bone. You have the tibia and the fibula, which are your leg bones together. And right under them in that joint is your talus, which helps support the ankle joint. And one of the more common fractures we see here, as you're coming kind of straight down, you can see how that would cause the energy to go towards that talus and fracture. And the reason that's important is that talus bone has a very tenuous blood supply. It doesn't take much to fracture it and tear the arteries supplying that bone. That bone can die even if we got to it early. So we like to avoid these types of injuries and fractures. Of course, you see in this picture, this diagram, these kids doing these somersaults, and of course, always makes us nervous, and how they land. Volleyball, very fun outdoor sport. You get to the beach, get to the sand, you got the water there. Very enjoyable. But you can get both knee and shoulder injuries. If you land and twist in the sand, that can cause a meniscus tear or ACL tear. Your kneecap can dislocate out of socket. Shoulder injuries from obviously landing the wrong way, you get a dislocation or what's called a labral tear, which is the cartilage around the socket. So sometimes there is no avoiding this. It just happens. But these are the common injuries that we see related to this sport. Of course, we try to train a lot of our high school volleyball athletes, especially the young women, on how to land and jump properly. And if you do have a young lady that's playing volleyball, doing some jump training is one of the most important things you can do preventative-wise for volleyball and basketball to prevent injury. And the reason I just mentioned females, we know they're more likely to suffer these injuries than young males. And a lot of that has to do with their ability for jumping mechanics, how, female anatomy is set a little bit with wider hips. So that's very important as a preventative to get to a trainer or get to, a therapist to learn some of those landing techniques and prevent injury. Carnival rides, be careful, especially with these, not so much the big parks, but these kind of smaller fairs that get set up, the traveling fairs, always be mindful of kind of how you see the machine operating. Is someone there operating it safely? Use the straps and crossbars that they have. Secure your possessions. If you have long hair, get that, tied up so it's not too far away from your body. Keep your hands and feet inside, as they always say before you take off. But one of the big things with this is whiplash. And you can see on this diagram how that sudden kind of stop causes that hyperextension injury. And that can cause either a disc herniation in the neck, strain of the muscles of the upper neck and shoulder. And most of the time it's kind of rest and physical therapy to treat this, but certainly can have a big impact on your day-to-day. You don't realize how much we use these stabilizing muscles until they're hurt. And it's something, I saw earlier today in the clinic. Something to worry about is if you had just constant pain or numbness radiating down your arm, if you notice that your hand was suddenly weak and dropping things, and then that's something more than a strain. That's something that may be a pinched nerve, a disc herniation in your neck. And, you come see us, you come see our neck specialist, and, we order the MRI to assess that. Water sports, one of the common injuries here is the hamstring tear. And that happens usually when there's, as the skier's kind of stabilizing, that sudden pull of the boat causes the skier to kind of bend down, and that pulls, if you imagine, in this picture, person bending forward suddenly and kind of tearing that tendon, as you see on the right side here. So, if there's, 4 tendons there, 3 major ones that are attached on the bone, and if those tear significantly, those can need surgery. Most of the time it's a strain or a partial tear. Those we can rehab and just rest, but it's one of the more common problems with this, as well as, shoulder and wrist injuries. And that was it. I tried to just hit the kind of the most common things. It's a pretty short talk. We have our 3 locations in Brighton, Novi, and Southfield. We have online appointment scheduling at thecoreinstitute.com. And thank you all for your time today, and love to take any questions on these topics or anything else. On a sprained ankle, yes. So there's different degrees of sprains. Grade 1 is the smallest. And anytime that you get an ankle sprain, it just means that you have a small or partial tear or stretching of the ligaments that support it. So grade 1 tears, sir, you'll feel some pain, some swelling, but typically you can walk on those. The grade 3 tears are when you get the big balloon swelling, you can't even bear weight. That's when you think, oh no, I broke my ankle. And so one way to kind of assess that is the tenderness more on the bone or kind of in the soft tissues, of whether you decide to, go that night to the emergency room. We have next day appointments. We're always glad to see you and get the x-ray. Is it something you have to go to the emergency room for? No, you can certainly ice it, get an ACE wrap on it, some anti-inflammatories, and come see us the next morning to make sure that there isn't a fracture. But lower grade, certainly you'll be able to walk on it. Higher grade, more energy, so more swelling, more pain. Be difficult to walk on. We have to rule out kind of fracture, but short answer to that is yes, you could. Any kind of tendonitis around the elbow is typically an overuse thing. So one, maybe kind of backing off on some of the activity and the repetitions of that activity. And 2, focusing on the stretching to get those muscles and tendons working at an appropriate length, and anti-inflammatories as needed, compression wraps to help give some more support to the tendon. Getting to us to see if you need an injection or any kind of formal physical therapy. But most of the time, a little bit of rest and some proper stretching and strengthening. So rest alone is not just a trick. It can certainly help decrease the inflammation and the pain. But if you don't stretch it and strengthen it properly, the next time you go back to that activity, that same tendonitis is going to come back. And so rest is one part, but it's also the therapy, the stretching, the strengthening to condition that side so to prevent re-injury. Good question. Again, it's, that knowing your body, knowing if you're, a novice or, a more seasoned kind of runner, getting the appropriate footwear. Do you need orthotics? Changing your shoes at the appropriate times. And then a lot of lower extremity stretching, rolling out those IT bands, your Achilles tendon, getting your hips, properly stretched out, strengthened. And then creating a slow and steady build up, a nice training regimen, running with someone who's seasoned, who's done this before. There's coaches I know that do this stuff. So, getting to those people to know, how to properly train. And then, of course, that's not an easy thing to do. Having the good supportive family around you, having that motivating factor to keep drive, because there's going to be times where it's not going to be fun. It's, but I think, it's very rewarding, obviously, and focusing on conditioning your body for this, and the proper equipment, which is the shoes, is the best way to get a successful outcome. Well, some of that's genetic, so it's hard to say yes or no. The more joint injuries we have, the more prone we are to arthritis. Sometimes it's just wear and tear. The tires eventually run out, and the joint needs to be replaced. So arthritis happens for those reasons. Now, keeping our weight down, avoiding obesity, and keeping our weight down is important, because the weight is a 4-to-1 ratio. So if you lose 10 pounds, you're taking 40 pounds of pressure off your joints. Okay, so just those small incremental losses can make big effects on the hips, knees, and ankles in helping to prevent arthritis. Eating healthy, avoiding sugars and salts that are known to be inflammatory to our bodies and our joints is important. Sometimes there is no preventing it. Like I said, it's just genetic, or just with age over time, things run out. And having a big traumatic knee injury or shoulder dislocation might just cause that arthritis. And so the number one thing that we see, at least for lower extremity, is weight. That's a big, epidemic in our country and across the world, and it's something we're continuously having discussions with our patients about. So HA, for those that don't know, is hyaluronic acid. Hyaluronic acid is one of the components of the knee lubricant that we normally have. Okay, the knee, the cartilage, the proteoglycans, and the structure of the cartilage is made of secrete a fluid, and which provides nutrition to the joint. And that's the hyaluronic acid. It acts as a lubricant and a shock absorber for the joint. And so in arthritic knees that have lost some of that support structure, we inject the hyaluronic acid to help kind of boost that. And it helps in some ways decrease inflammation, but mostly, again, acting as a lubricant or shock absorber. And so it is recommended in patients that might have mild arthritis, or even in severe arthritis, that either are too sick to have surgery or don't want to have surgery for any reason. And so it's another treatment modality that we have. Cortisone or steroid is just an anti-inflammatory. It's not necessarily treating the arthritis. It's a kind of a Band-Aid. The hyaluronic acid, or the gel shots and lubricant shots that you hear of, are acting as just another option we have to treat the joint, to help lessen pain, improve mobility. Again, it's not necessarily repairing any damage, but it's something else to help treat the symptoms.